Hello, my name is Tracy Tribuck. Welcome to Your Health Matters. Today we'll be discussing several important health topics, including substance abuse on Long Island, liquid nicotine, and youth sports safety. And now I'd like to welcome my guest, Legislator Sarah Anker from the 6th District in Suffolk County. Sarah, welcome back.
Hi, Tracy.
Hi. Last time you were here, we discussed bullying awareness. Can you briefly discuss how that campaign is going in the county?
Sure. So when I became aware that bullying is incredibly invasive in our school system, especially cyberbullying, I worked with the county resources and created SuffolkStopBullying.org. And I highly recommend parents, teachers, students go to that website. There are so many wonderful resources. What we did to promote it, we had a bullying awareness video contest, and we had some students win that contest. We had Mike Del Judas from Big Shot. He plays with Billy Joel, and he presented them with an award, and it went very well. You know, again, we just need to get the word out there. And also, the message from that bullying awareness advocacy is that students need to be an upstander and not a bystander. They need to engage themselves when they see something is going wrong, because you want to treat people the way you would want to be treated. So this is a way of doing that. And again, we're trying to promote the idea of being an upstander.
Okay, and just for those who perhaps didn't see the show, because you were on here last year, an upstander is someone who comes to, when they see somebody is being bullied, they come to their aid and assist instead of just standing passively by and just observing.
Right.
Okay. So
and also, New York State created the Dignity Act, and they have a DAC, a Dignity Act coordinator, and that's the person, the to-go person at every school that if you feel you're being bullied or if there's issues, you go to that person, and we have on the website information pertaining to the school district and that person that you can reach out to.
Okay, wonderful. Okay, well, I'm happy to have you here to discuss your efforts in Suffolk County and some recent legislation, and you also have established an advisory panel, so we're here to discuss these issues today. First, let's discuss some substance abuse issues. In April of 2014, you established an advisory panel to address the lack of long-term substance abuse treatment facilities available in Suffolk County. And the panel was created to assess the inadequacy of facilities and services for substance abuse rehabilitation. Would you like to discuss that for a moment?
Sure. So basically what's happening with the drug abuse situation is that our children are becoming addicted intensively in this area throughout the country. And what happens with opiates and heroin, it takes a longer time to go through rehabilitation. And what happens, again, with the insurance companies, the hospitals, they limit the ability to recover from addiction. So what I've done is, I created the panel. We looked at different locations. We're focusing on the John J. Foley Center, which recently has been agreed to be purchased by Brookhaven Hospital. Yes. And they have agreed to place a rehabilitation center at that location, in addition to other services that they'll have available. So again, that's one resource, but we need more places where our residents can go to recover for long-term rehabilitation. And I'm working with Hope House, Father Frank, and other organizations to find these locations.
And that was going to be one of my questions, by pulling together key stakeholders within the community. I'm trying to raise this awareness and see about getting the assistance that we need, and seeing if, as I was going to ask you about the Foley Nursing Facility.
Sure.
So I'm glad to know that they've agreed to do that.
Right.
For substance abuse and mental health.
And mental health, addiction goes hand in hand with mental health. They're co-occurring illnesses, and we need to address that. Both the mental illness for, whether it's drug addiction, we have the post-traumatic stress disorder from our veterans coming back. We have dementia, Alzheimer's from our senior community. We need to address that, and government, at least at the federal level, they're not doing their job. I'm telling you, we need to do more on a county level. I'm doing everything I can, but again, we need to work with the other levels of government and focus them and prioritize the lacking issue of help and assistance with this.
Now, is this panel still in existence and looking at?
No. At this point, we're focusing on other issues. When you talk about drug addiction, there's education. So I worked with the local school district and the county executive to create a public service announcement about drug addiction, and we interviewed a mother who'd lost her son. This stuff is serious. These kids don't realize that opiates and heroin and the drugs out there can literally take away their minds and permanently create illness, mental illness, for the rest of their life.
Yes. Okay.
So again, we're going to focus on again, education, enforcement, rehabilitation. Those are very important components with the drug addiction issue.
Okay, thank you. We will be right back with Legislator Sarah Anker from Suffolk County after these messages.